I'm Professor David Boyd. I am a faculty member in the Duke Global Health Institute. I focus quite a lot on undergraduate education and in particular on issues of vulnerable populations and indigenous medicine. In the State of Wonder, Dr. Swenson, under the guise of producing a fertility drug that will make a pharmaceutical company quite a lot of money, is actually working to produce a vaccine against malaria. Malaria is one of the great scourges of global health. It affects probably 200 to 300 million people a year, primarily in sub-Saharan Africa. One striking phrase in the book is when Dr. Saturn says to Dr. Singh that research does not take place in a petri dish. That may very well be the case, but nor should research take place on populations without their consent. Whether we are conducting research in high-income countries, in lower middle-income countries, respect for persons and informed consent is one of the keystones upon which research is based. Even though Dr. Swenson was clearly trying to create a vaccine that would benefit millions and millions of people, nonetheless, her experimenting on a population without its consent violates a key ethical principle. The majority of drugs that we use today originally came from plants, and in fact we're discovering new drugs all the time from plants. These indigenous traditions have much to offer, but at the same time they're very difficult to unravel in some ways. As you notice in the book, it's not simply the tree bark, it's not simply the moth's secretions, it's the combination of the two in some way and some sort of interaction that takes place between them that actually cause immunity to malaria. So the novel, I think, really represents how traditional medicine has great use, but it's very complex to take that knowledge and turn it into modern science. Fiction has an impact on how we think about the world around us. It has an impact on how we interpret the reality around us. Fiction can also raise our awareness of issues that exist in the world of which we had not thought before. The choice of State of Wonder is a good one. Not only is it a compelling narrative and well written, but it also provides insights and provides food for thought about some key issues in both global health, ethics, and social justice.